Hey, everybody. Welcome to Medicine 3.0, your podcast for all things AI and health, precision health. This week, I've got Taylor Heppner. She is a trainer as well as a massage therapist, has worked with elite athletes, and her specialty is return to performance. So she's going to help you go from injury back to doing what you love to do. We had a really cool discussion. I think you're going to learn a lot. Enjoy. All right, Taylor, welcome to the podcast.
Awesome. Thanks for having me.
Well, I'm really excited to share your knowledge with our audience. And to get us started, can you tell us a little bit about how you ended up where you're at, knowing what you know?
Yeah, so I have always been interested in sport. I was the kid that played every sport my parents and my family could let me play, and more if they would have, there was more time in a day. And at some point got super interested in the sports medicine kind of side of things. I remember being like seventh grade, maybe doing a project about sports medicine. And so I've kind of always been interested in it. And all the way through college athletics, was able to stay pretty healthy, but also know that, I trained and I worked with people who knew what they were doing and were able to help me stay healthy. So through college athletics for a year at Washington State University and got connected with their strength and conditioning program. And our director there was a huge mentor to me, and let me kind of piece together all the things that interested me between ex-phys lab and biomechanics labs and PT and strength and conditioning, kind of make it my own. And that really sparked my career and kind of let me make it what I wanted it to be. And then through grad school and internships, I ended up working in a sports medicine and sports performance kind of collaborative setting with Exos in Vail, Colorado, and then just continued to grow it from there. And am now the director of performance recovery at a sports performance company in Denver called Elite Speed, and working on my PhD in this space.
Awesome. So obviously a ton of knowledge around sports medicine. Also, I think you shared with me earlier that you're also a sports medicine massage therapist,
Yeah.
Which is kind of this neat mix of kind of the performance side and the recovery side. And that's where we're going to kind of dig in. But I also think it's fascinating. I took like a trainer course when I was in high school because I also loved sports medicine. So I would like go to the basketball games, tape ankles, and like try all that stuff. And I think that what is interesting is often we think of like, because medicine is in the name for sports medicine, we think like all medicine is kind of the same, but sports medicine, I think of it as very different. And I'm so glad it's becoming more mainstream as we realize that if we want to be healthy, we actually have to kind of be athletes of our own lives. So I'm curious how you kind of think about this space of like sports medicine, recovery, all of that.
Yeah, I mean, it really starts with like the simplest things, and it's just moving your body and doing, exercise is medicine and doing the things that feel good. And I think like that's the kind of the foundation, that's baseline. And then, the more specialized or specific your goals are, then the more specialized and specific your programming or the kind of the plan of action gets. But I think it starts with, sports medicine. Everyone thinks of just, the highest level athletes, like the 1-of-1. But it also is our grandparents and kids and anybody that's moving, that might, the injury or the life might not revolve around sports, but it is similar to how athletes get hurt, and they still need that approach in the sense that they still need to be able to move and be functional and be long-term healthy in their bodies coming out of whatever that situation might have been, whether it was, a hip replacement or a broken foot or whatever else it could be.
Right. And where do you feel like, where does your expertise sit in kind of the realm of practitioners? Like you've got physical therapists, you've got trainers, like where do you kind of see your expertise fitting in there?
Somewhere right between kind of strength and conditioning or trainers and PT. I've had the privilege of working with very dynamic teams and seeing how beneficial those can be, from like sport coaches to athletic trainers and MAs, PTs, um, all of the above. Anybody really you can think of, dietitians, psychologists. But I think with the massage therapy and the strength and conditioning background, I've been kind of able to find a space in between where PT ends or people aren't really sure if they need physical therapy and there's kind of this question mark around it. And then, okay, but I don't really know what to do on my own or how I would even start or what I need. So that's kind of the space that I've carved out and really liked, kind of living in the gray area a little bit, and getting to do a little bit of both and help people. I'm lucky enough to have clients and friends and family ask questions and be able to help them distinguish, like, should I be training more? And if I am, what does that look like? Training for my parents and then training for, kids trying to go to college on scholarships looks very different, but they still need to be doing something with some consistency. And then where, okay, well, maybe we also need to work in some soft tissue work or cupping, or, maybe you need to see a stretch therapist, or this pain's been kind of lingering. Now let's work you into that physical therapy setting and, see if we need to do anything more specific. So I like that in between. That's where I get to live. And it also keeps it interesting. Get to do something different every day.
Awesome. Well, let's drill in a little bit on that space. And I think this is so applicable to everybody. You kind of laid it out. Like, it could be post surgery, it could be an injury. I've actually had a hamstring pull twice this summer, which is super annoying as I'm trying to train for running. And, everybody is kind of the athlete of their own life. And like high level athletes, they might lose money. And like you said, there are athletes trying to get scholarships to D1 schools. And then there's high school athletes. But really, like, we all want to keep moving our body as well as we possibly can at whatever point we are in our life. And so I'd love to kind of go through, and maybe it's even thinking of examples of, or a case study where you say, okay, a person comes in like this, and this is kind of the way that I think about it with them and educate them as far as how do we get you back to doing what you love?
Yeah, and I think you, like, again, you kind of said it yourself there, and we always define with my team that the athlete is not what you might think of as far as like sport goes. It's somebody who, want to put the work in and they have a goal in mind, whether that goal is playing with my grandkids or those D1 scholarships. So it really works up and down that spectrum. So when we have people that come in, it's really, I'm meeting you where you're at. I don't know that yet. We got to kind of figure out that spot. So if it's somebody who has come, maybe just from the world, not from, orthopedic or PT setting, it's very like digging a little deeper, trying to figure out what their goals are, and why those are their goals is a big part, especially when we're talking about the general population client. I've had several people who've come in and it's, hey, I want to lose 10% body fat, or I want to lose 20 pounds, or something of that nature. My knee, I just don't want my knee to hurt anymore. Okay, obviously getting out of pain is a really important goal because that's your quality of life. That's going to keep you moving. It's going to keep you doing the things you like doing. But then why did you settle on this, 20 pounds or whatever it might be, and kind of trying to dig a little deeper there with them. Because then it leads you to that, maybe like, oh, well, actually, it's really because I want to feel comfortable, going on the playground with, my niece or nephew, or somebody in my family, or I'm a caregiver and it's gotten harder and harder for me to, provide that care. So I think there's that side of it, and digging deeper there really helps, just to get to know the person and really what motivates them and what's realistic for them. And then from there, it's very, how do you move? What does movement look like for you right now? And then what does self-care look like for you right now? I think those go very hand in hand, because on the recovery side, and especially when we think about like massage therapy, that's great. And training is wonderful also, but it doesn't do a lot if you're not sleeping or if you're relying on a lot of outside factors to kind of get through the day. So kind of helping then figure out why and where we're at currently, and then looking at, okay, here's everything we're looking at. Where do we need to scale back? Where do we need to lean into a little bit more in educating, that person on the why behind those things, and knowing that they can then feel comfortable coming to me with questions, or knowing that, if they can't do something one day, like, it's okay, it doesn't make or break the structure we're building. We want it to be flexible, to be sustainable. And then if it's somebody who comes from the orthopedic side, maybe with more of a specific injury in mind, it's a lot of, okay, when and why did this injury likely occur? What imbalances or previous injuries or things like that are at play here? How's it affecting your movement? And then kind of assessing that and building back from that standpoint. But outside of that first initial questions and the starting point, the process looks pretty similar. It just might be kind of taken to a different degree or level of difficulty depending on the person.
I love that you start with motivation. I feel like sometimes it's so easy to just jump to the problem. Like, what is it that's bothering you? We're going to fix that thing. But understanding the motivation so that you really understand, like, how bought in is somebody to do the work that they need to do,
Yeah,
and what is it that's really driving them, and is it something really core or integral? Is it not so much? It could be just aesthetic or whatever, but like, understanding what that motivation is, I think, is just so important to helping people with change, because
yeah,
change is hard no matter how
change
you
is
do it.
hard. And I think something I've seen a lot, I actually was talking to a client this morning about it, is that, you came in and one of the first things we talked about was the fact that you have low back pain. Well, okay, we need to address that obviously. But now I'm reminding you that, like, the consistency is important because you don't have low back pain anymore, and we want to hold on to that, like, happy, healthy space we're living in, not, get complacent in the sense that we kind of take our foot off the gas and then all of a sudden you have back pain again. So trying to, use that as our original motivator, but then also, like, as a good reminder of, look how far you've come, look what we've built, and even if we're going to scale it back or we need to make adjustments, but how do we sustain where we've came, how far we've come?
Yeah, yeah, I think that's so important. As you work with people, what do you think is kind of the biggest misconception as people start to come see you, that they kind of have in their mind that you kind of try to educate them on?
I think it's a lot of the, like, 0 to 100 mentality. It's
Mhm.
not, I guess, not necessarily like they're wrong in wanting to do whatever, but I think it's just the reality of, hey, if you're coming in and you're telling me you want to run a marathon in a month, but we have pain, that's just not realistic. And obviously that's a kind of dramatic, would be a dramatic example, but I think that is kind of these, like, big leaps that people want to take, and they put themselves on a relatively, like, strict timeline, and not really understanding, like, I do a lot of educating and they're like, okay, this is why we're taking this approach, starting smaller, working on the foundation, and then building it up from there. And I don't, it's not exclusive to, general population or your high level athletes. Everybody can kind of fall into that trap. I'm sure you have at some point. I have at some point. Like, you get excited about something, you want it now, but it's really more about the process of things. I'm working with a sprinter right now, and she's also recovering from some hamstring injuries. And she it's kind of, for like the first couple of sessions, like, very slow, very boring. Like, we're learning how to use your core, we're learning how to use your glutes, maintain your breathing patterns. But now that we've built up, 6 months almost, and we're starting sprinting progressions again, and she's like, wow, this is a lot easier. Here we go. That's why we did this, not because, if we didn't do that part, you'd sprint and probably strain your hamstring again. So, working and educating from that perspective of, like, I know you want to sprint in a week or in a track meet in a couple weeks, but we really need to take this time while we have it and be smart about it so we're not dealing with the same issue in a year.
Yeah, it's it's so hard for people. I think you see it across, like, all habit change, where people like decide they're going to exercise. They're like, I'm going to exercise at 5 a.m. every day for the rest of my life, and
Yeah.
they start that the next day, and it lasts for 2 days, and then they sleep it. Or I'm gonna eat like really clean forever from now on. And like, so important to understand like how incremental change is so much more sustainable and how we can actually make progress. And yeah, I injured myself with sprint training because I wanted to like get my mile speed down. And of course I went out and went way too hard. And then I only waited like 2 weeks and tried again and pulled it again.
Yeah.
And so
And here
I
it's
fall
kind
into
of like
that.
that what we see with like crash diets, right? But it's just on the movement side of it. So I don't think
Yeah.
people don't necessarily think about it the same way, but I'm like, it's the same concept. We're just putting it in a different space, but it's much more about the incremental change that's sustainable.
Yeah. So like not everybody can have you at their side. And so if you were going to give like general like guidelines or ideas for somebody who has some, let's say it's a nagging injury. It's like not, we don't think it's a concerning kind of thing that you need to even see physical therapy for. Like what are some of the guidelines you would tell somebody like, I want you to think about it in this way, or look at these resources as you try to get back to doing what you love?
Yeah, I think, if you don't have access to someone that you can go and kind of do things one on one with, as much as there's pros and cons to it, the internet can be a great resource for movement. But I think even before that, it's what feels good now, keep doing. So if you have a nagging, knee pain, but you notice that when you're walking on an incline, it doesn't hurt, doesn't bug you, keep walking on an incline. Let's keep doing that. And maybe if it's 5 or 10 minutes now, but maybe in a couple weeks that could be 20 or 30 minutes of no irritation. And then especially when it's, nagging joint pain, whether it's knee, ankle, back, whatever, motion is good. Motion is medicine. So keeping range of motion, when you're sitting on the couch, can you also be like bending and straightening your leg or using a strap to do something like that? Or all the time, if you don't have a stretch strap, I tell clients all the time to use a dog leash or a belt. You have those at home. You don't have to go buy something new. And I think so, motion and then anything that doesn't hurt. And then just slowly progressing with like daily movements. If you catch yourself going to sit down for the dinner table and you're holding onto the table while you sit down, let's try to control it without holding onto the table. Now you're doing squats with probably some better form and more engagement and kind of building it up from just like daily activities. And then every athlete or just, somebody competing in sports or somebody who's just being active for life, paying attention to how you're breathing, I think is a huge thing. A lot of people that I've seen don't realize how much they hold their breath when they're doing simple daily motions. Sitting down and standing up is one that I hear a lot. Or they think, to brace their core, they're really holding their breath and then they're like shocked that they're out of breath. So I think paying attention to breathing patterns and little things like that is the place to start. And then, finding little ways within that to challenge yourself. Are you adding time or adding incline to that walk? Maybe adding a little bit of speed if it feels good. Or, oh, okay, I'm like, balance is better or my squats feel better. Now can I hold on to a backpack or some textbooks? Or I have a kid at home. Let me hold on to my kid and, use my kid and have them exercise with me and just build from there. And then kind of increasing the variety from there and using potentially the internet for resources. And you just always tell people like, don't try to avoid moving into pain. So if you feel a twinge coming on, that's your guideline. Don't push it. Don't force anything. And then if it feels good, keep doing it, but find ways to challenge yourself within that.
I love that. So I kind of took away three things. So it's do things that are feeling good, help yourself progress, and then learn how to breathe and pay attention. And then kind of just some of the core of progression for performance, which is continually overloading a little bit more and paying attention to what hurts. And it is so fascinating. I love that you brought up that movement is medicine. Um, because that's changed a lot over the years. You know, it used to be like somebody would have a back injury and you'd tell them to lay in bed, and now you tell them to walk as much as they can. Or even when I first started my training, like if somebody tore their ACL, we'd put them in a knee immobilizer, and now we're going to try to get them, as long as their other ligaments are stable, we're going to try to get them exercising and moving that knee as much as possible. And it is remarkable how good the body is at helping you through whatever kind of injury, as long as you don't like re-injure it
Yeah.
or push yourself too hard.
Yeah, definitely a lot of educating on that space in between rec. Movement is medicine, but don't overdo it. There's a happy medium there, and I think what we've seen, as the sports science, as like a true science, has gotten better and better with research and resources, we've seen so much more of that. Like, okay, find this happy middle ground. Another, good example is also concussions. We
Hmm.
for so long sit in a dark, quiet room but don't fall asleep. And now more, okay, some light activity like going on a walk, those types of things can help a lot in your, rehab or recovery as a whole. But there's a lot of fear around that, especially if an injury is involved. There's a lot of fear around motion. So it's starting with the super gentle and slowly, gradually building that.
Hmm. You mentioned the internet is good and bad. Um, I'm curious, do you have resources that you like, and or people that you follow on social media that you think like they have great content that like teaches good principles?
Yeah, I think there's the rehab guys out there. They do a really good job. And then there's tons of people on especially social media that put out a lot of really good resources. And I always kind of steer my people, whoever you kind of resonate with is fine, but check kind of their credentials, because there's also, I don't want you coming in here telling me you're trying to lift a barbell with your feet while you do a pull up or any like something crazy. We don't need that. Look at their credentials, and then find the people who are explaining the why as they're showing you the demo, because I find that those tend to be the more reasonable, I guess, demonstrations of things. And then there's some companies, larger companies also, like Exos puts out a lot of resources. Exercises Medicine is another one that's really has a lot of really good resources online. And finding someone or personality or someone that you like looking at or listening to their voice, and then kind of using them as your example.
So that's awesome. I'm sure people will kind of look through some of those that you mentioned. When somebody comes to you and they're in pain, but you're trying to get them kind of back to movement, how do you help them think about their pain or work through their pain?
Yeah, so it does vary a little bit depending on the source of their pain, and whether it's been more of an acute injury. They know exactly what happened, or they're like, I don't know, this came out of nowhere. I woke up and all of a sudden this hurts. So it's a slightly different approach based on that, of just kind of getting to the root of it. But I think for the most part, it's how I always am asking my clients to describe their pain. They're like, it kind of is like pinchy, or like, I don't know, it kind of hurts right here, wherever it might be. Okay, find another way to explain it to me. Does it feel like it's somebody poking you? Does it feel like it's stabbing you? Like, describe it in a different way. Because typically they'll kind of start talking through it and help me understand a little bit more. And then everybody's probably least favorite question is like, okay, where are we at on the pain scale? Is it totally, totally fine? Or is it the worst thing you've ever had? And now, you've never been in more pain than that. And if we're 3 and below, I'd usually err on the side of movement is good for it. And might take a couple of tries, but let's find movements that don't irritate it, don't make it feel like it's getting worse. And if we can find movements where you're still very aware of it, but it's staying kind of the same level of pain, it's not getting worse. Can be okay with that sometimes. And if it's getting worse, then we need to really, really address it. So starting there, and then looking at this, signs and symptoms physically. Are you limping? Is it red? Is it swollen? Is there anything else going on? has it been going on for a while, and I can see, if it's knee pain, I can see some deficit in your quad strength or size, and going from there. And then, kind of starting again that gradual progression of range of motion feels okay. We have all the range of motion we're supposed to have. If we don't, passive versus active, and then building from there. If it's active range of motion is good, now let's go into more traditional like strength based patterns and kind of build gradually. And I check in pretty much every time I see people, or if it's somebody who's been more constantly in pain. Like, okay, now tomorrow you should feel like we did something. I won't be surprised if you feel something, but I don't want you to be in pain. So if you have to modify your daily living tomorrow because of what we did today, we did too much and we need to course correct a little bit. So if there's not, specific, like an ACL tear, like you mentioned, where there's more specific protocols, that's kind of the approach I'll take. And then we'll modify from there. And if it's not improving, then I'm very lucky to have a wide base of resources and people I can refer you to let's make sure there's not something bigger going on.
Yeah. I feel like even though, I mean, we talked about the internet as a resource, the good thing is if people have insurance, most people will have some ability to get some professional help. And
Yeah.
especially as you age, and if you stay active, you're going to have injuries. Like it's just going to happen. And so I'm curious, like, how would you recommend somebody like go about finding like a good expert? Like, what should they ask when they are interviewing a physical therapist or a massage therapist or a trainer as they're trying to figure out, like, is this somebody that I should trust in helping me rehab?
Yeah, so I think that can be kind of a loaded question. I'm sure you've experienced it too, but the training and the massage therapy side of it is the credentialing process, or going through the education side, is a little less strict than it is on the medical side. So obviously your doctors and your PTs, they're held to a more consistent standard. So I think there's some comfort in that. And then from the medical side, asking, is this your specialty, or have you seen this before? Especially if there's a surgeon involved, have you worked with this surgeon or their protocols before? Just so that you as the patient have that layer of comfort and security in that. And then always telling people to speak up. If you have a question, ask. Like, it's your care. They're the professional in the situation, but it's your body, your care. So always encouraging people to speak up and ask if something's kind of bugging them or on their mind. And then whatever your goal is at the end of it, if it's that active living and you don't have any big activities in mind, you just want to be comfortable moving around and doing the things you like to do, make sure that that's known. If your goal is going to play D1 lacrosse, maybe you want to see if they've worked with a lacrosse player, if they're familiar with the sport, so they have a better understanding of the demands that you'll be putting your body in. And then the other side for training and massage therapy, especially if there's some sort of injury or pain involved, will always tell people to look for somebody who has some therapeutic connections, whether it's they're partnered with a physical therapy clinic or they have worked alongside of a medical, facility, because they tend to be more familiar then with those processes and that background. But that's not required. Then start to look for, what certifications do they have, what populations, and this is where I think social media can be really helpful. What populations are they showing the world that they work with? Then that can be like a really good resource. And again, asking questions. And I think, especially with our team, we see people come in and they're like, I play basketball and I want a basketball specific trainer. Like, well, do you want somebody who played basketball, or do you want somebody who has a really, really good understanding of the demands of that sport and can still be basketball specific, even if they didn't play that sport necessarily? So I think trying to get out of that, like, you have to look like me or move like me to be a good resource, and more looking at, do you have a good understanding of what my total needs are? and then you can kind of fine tune it from there. In the training world, we look at like the CSCS is the kind of our gold standard. So do people have that certification, or do they have they done any other continuing ed, and maybe in a more specialized setting if that is appropriate for you. And then the same, very similar in the massage world, there's lots of like specialty certifications people can get. So from their base, credential in their state, what other avenues have they gone down to educate themselves and make themselves a well-rounded provider?
Mm-hmm. And I like that you also mentioned like using people that you know and asking, um, asking like, has this person worked with lacrosse players, or like asking your lacrosse coach, do you know physical therapists that have, or trainers that have done well with players in the past? My daughter rock climbs competitively, and she injured her hand and arm recently. And so like one of our first things was to go to her coach and say, okay, who are the physical therapists that work with rock climbers around here? And so I think that's like sometimes people forget like the network, that networking is a really good way to find the right expert.
Yeah, absolutely. And your coaches have been in that sport for a long time, or activity, or and even outside of sport, the people who are doing the things you want to do, just ask them. Even if that thing you want to do is, well, I'm in Colorado, so if you want to ski 100 days, but you have pain while you're skiing, people that ski a lot, ask them, just people
Yeah.
and kind of go from there.
Yeah. Um, Taylor, this has been an absolute joy. Where can people find you if they want to work with you? Where can they find out more about you online?
So on Instagram, trained by T, a little misleading because I do massage work also, but trained by T. And then I work with Elite Speed Sports Performance, like I mentioned. So on our website, eliteperformcenter.com. Yeah, those are the best places probably.
Awesome. Taylor, thank you so much.
Of course, thanks for having me.
Thank you for listening to another episode of Medicine 3.0. We make this podcast so that you know where to turn for good information on keeping you and your loved ones healthy. Feel free to check us out at bionichealth.com, where we can help you live a longer, happier life.